Hi, hello. I'm Dr. Whispers. How can I help you today? Okay. Oh, I do remember. Can I have your name again? I'm very good with faces, but names I tend to forget. I'm sorry. Of course. Okay. Yes, I have your information here. You're here for a follow-up appointment. You had a full otoscope ear exam about 3 weeks ago. We did a full cleanup and also irrigation. Oh, I see. Let me check. We also did biopsies, right? Hopefully the results are ready for that. Yep, they are here. Well, there are no pathologies, no source of infection, bacteria, or infestation, which is great news. It just means that your body is overreacting. I know it sounds very simple because it's a big issue for you and it's something that disrupts your life, but for what I see in the information, there is, at least from the samples, nothing wrong in it. We might have to take some blood samples and maybe do a DNA search. Sometimes we can get some clues in there about the cause, and maybe with that we can find a solution. Sometimes with the biopsy alone we can know if there is bacteria present. I have some patients that for some reason love to go swim in swamps. It's their life, they adore it, and they come with me and have very bad ear infection, and what we see there is filled with bacteria, which is common for those places. But with you, your ears are intact, are clean, are squeaky clean, no bacteria, no pathogens. There's really nothing. It's all you, it's all your earwax present, which in one side is good. It means that your ears are healthy. It's maybe something mechanical, something in your code that is causing this overreaction. Let's see, on past biopsies. No, I don't see anything either. Okay, let's dig a little bit further. Do you recall about your childhood, if this was a problem that was present back then? Couldn't really tell. How about your family? Okay. Well, that's okay. If there is no medical history, it means that it's nothing that was so serious to have in your history here. So I would like to go forward with the blood samples. That is going to help us understand you a little bit further. That will take a little bit longer, about maybe a month, sometimes a little bit more. Sometimes we are lucky, we have it in 2 weeks, but more or less 4 weeks. Yeah. Okay, I'm going to send the order. We're going to do it today after your ear exam that we're going to do in a second. And hopefully it's going to give us more clues about this. Very good. Okay. Perfect. Now tell me, in the past 3 weeks, have you felt any different symptoms, or have you felt the dizziness that was present before? Maybe problems with hearing, sleeping? A lot of itchiness in both ears? Okay, Okay, we are gonna examine them first. Okay, tell me about the itchiness. Is it too strong? It feels like, oh, it's bothering me so much. Mild? Okay, that's good. Have you gone to, I don't know, swimming in pools, swamps, the sea, any places, or saunas, maybe steam? There is some spas that have steam treatments. Not really? Okay. And is this itchiness all day long? Or it happens maybe only at night, during the mornings, while taking a shower? Random. But it's constant. Okay. And you haven't been using any cotton swabs in your ears, right? Very important. Okay. We're gonna inspect here first. Okay. Let's do this other ear. Very good. Well, there is a lot of earwax. I do recall cleaning it very, very thoroughly, and the amount of earwax that you currently have, I would say it could be an accumulation for a regular person of maybe 6 months, and in your case, I'm seeing it. Wow, in 3 weeks. Yeah, it's quite a lot, but it doesn't look impacted. It's a little bit softer than before, it's good. That is not impacted. The itchiness that you're telling me, I don't like that. Okay, I don't want to scare you, but it's necessary to give you the information. Sometimes when there is itchiness present in the ears, it could either be to infection or infestation. Some people prefer infection, but infection may lead to pain. But infestation is, could be little bugs in there. It happens, especially during these times of the weather. We don't notice. It doesn't have to do anything about how you clean yourself, about hygiene. Not at all. Even the cleanest person can get it. It happens. It happens. It could happen to anyone. But I'm seeing the signs of that. Most of the times can be maybe little spiders, little tiny bugs. Yeah, I know how it sounds. Yes. It's mortifying. But don't worry, if it's the case, it just means that it wants a cozy, a little bit humid place to rest. It's not gonna do anything to you. It's not gonna infect you with anything. Bugs don't really do that in the ear, the ones that like to go in there, unless there are the bad ones like little roaches. But I haven't seen a single case of that in my consult ever. So most of the times are little bugs, little spiders that cause no harm. They just want a little place to live. I know, it's mortifying. but I see it a lot during this time of the year. Okay, I'm pretty sure that's the case. Yeah, don't worry. It's okay. I know it sounds awful. I understand. But don't worry. This is gonna be very easy to deal with. The overproduction of earwax makes your ears the perfect cave for these little critters. Sometimes, especially during this time of the year, weather can be crazy. It's not stable. Sometimes it's extremely cold, then hot. So it happens. It happens, especially if you live in a place that it's prone to very switching kind of temperatures. But don't worry, we're gonna clear up. Gonna start by applying a serum. It's kind of like a bug spray, but it's just gonna kill them so we can extract them. Okay, don't worry, doesn't hurt or anything. You don't need sedation for this. Oh no, don't worry, it's okay. I see it all the time. It's mortifying, but it's okay. They're not gonna put their babies inside you. No. I haven't seen it personally. I've seen it on other places of the world that can happen, but I have never seen it on my medical history here. Now, don't worry about that. Yeah, but it just means that the weather is crazy and little ones are trying to find a place to live. Yeah, I've seen it a lot. Okay. We're just gonna leave it there for a bit so we can prepare you for the ear cleaning. We are gonna have to do a very thorough cleanup this time. We normally do a very thorough one, but in this case, since there is infestation, we're gonna have to do it a little bit more sterilized. In order to do this, we do have to put you in relaxing medication so you feel more at ease, because I do notice that there are some levels of anxiety with this. Yeah, I understand. And this is going to help you calm down, lower your heart rate, because I can see it. And it's going to help us work better. Yeah. I'm going to use, I'm going to need my assistant during this, because it's a two-main job where we're going to work on both ears at the same time. Very important, well, as you know, not to move or talk during the procedure, but especially here. Now the little bugs are kaput, but to extract them without issues, we need to be very careful not to overdo it and maybe scratch the ear, which will be awful with an infestation. But for what I see with my otoscope is that your ear walls are intact. There's a lot of earwax, definitely. Very soft, which is good. But still, we're going to do mild scratching and clean up. And we're going to use an agent on your ears that is going to help it soothe. Because the cleanup that we tend to do for infestation, it's a little bit more harsh than the regular one, even when there is this type of rock hard earwax. Yeah, this one is a little bit harder because there is biological infestation. So we need to completely sterilize the area, clean the ear properly, and hopefully not get anything like that again. I don't really think it's gonna ever happen to you. I would say 1 in 1,000,000. Yeah, if it, even more. But sometimes it happens. So you just got the luck that it happened to you. Okay, let's see if it's ready. Okay. Still gonna send a sample of what we collect in your ears to the lab. I'm sure it's just regular one. Most of the time we don't even see it because they are really, really deep into the earwax, especially in your case since there is a lot. Very soft in this case. Don't recall in your medical history being this soft. Again, it could be the weather. Humidity goes up, then down, up, down. It's been quite crazy lately. So I think it was a perfect storm for that. But don't worry, I'm very experienced with this. I have actually done 2 this morning. So don't worry. I know it's mortifying and stressful for you, but you're going to be okay. I'm going to prepare everything with my assistant, and we're going to go to the room next to here so we can do the cleanup. Okay? You can go to the room right here and change your clothes, and there's a little cake for you. You can put your clothes in the drawer, and I will be waiting for you in the next room. Okay? Very good. Okay, now that I have you in position, I'm sorry about the lights. I know they are very harsh. So here I have the pill that is going to help you calm down, relax you. It's not going to make you dizzy or anything. Just going to reduce the anxiety that I know that is going through you. It's okay. It's normal. Okay, it's not gonna make you fall asleep, but some of my patients tend to take a little nap during the treatment. It's fine if it happens. Don't worry. And here is my assistant. This is Nurse Jonie. That is gonna assist me during this ear cleanup. Okay. Are you feeling comfortable like this? Oh, very good. Okay. Nurse, do you have kit number 8 and 5 ready? Yes, for infestation. Thank you. Okay, now, so I would say it would take us about 15 to 20 minutes. Sometimes a little bit more, but hopefully with that time we're gonna do a full cleanup, and that is gonna help you a lot with that itchiness that you were feeling. Okay, if at any moment you feel that you need to move, sneeze, or cough, please let us know. You can tap us, you can let us know. We prefer you not to talk. If you can raise your hand so we can extract the tools from your ears. Very, very important. Okay, are you ready? Very, very good. So let's start, nurse. Yes, can you set up the timer? Thank you. Okay, let's start. Hi, I'm sorry to wake you up. We have successfully cleared up your ears. Would you like to know about what we found? Okay, that's okay. No, I'm not gonna give you details. I know, I know it could be odd. It's okay, but we were successful. I'm gonna tell you a little bit more in my office. You can change back. The nurse has brought your clothes here, and I will see you in the office when you're ready. Okay? Perfect. I will come back. You took a little nap there, huh? How are you feeling? How is the itchiness? No itchiness whatsoever, no. Yeah, it was quite infestation there. It's okay. I know you were mortified and had a lot of anxiety about it, but it's normal. I was telling you we did too this morning. I don't know if there's something in the area that's been causing this. Probably it is because you're my third patient with this issue, so I think we might have to contact the authorities for this. It was bedbugs. I don't normally see them on ears, ever, but we are seeing it now. That is not good. So we have something very important to do, which is checking up your places where you sleep. Maybe you went to a hotel, or even in your house, or you visited someone. You were visiting someone. Yeah. Maybe there's something that is going on around, and yeah. We had 3 cases with you today. We had 2 about last week. So we definitely need to report this with the authorities. So probably there is a whole infestation going on. I do suggest you to go home, check out your sheets, changing them, clean it up, your mattress too. Any place that you have put your head, sofas, I don't know, check it out. Yeah, because it's definitely an issue that now I see could be something rising. So, yeah, we had to take very good measures here in the cleaning room while you were taking a nap because these little buggers tend to move a lot. So, yeah. Something that must be taken care of. We're going to be contacting the authorities for this. And I have just a couple of questions. Have you traveled outside the city? So you just on this person house that you stayed in the past 5 weeks, right? Okay, yeah, that is the same with my other patients. There's definitely in the city, so yeah, we're gonna take that into consideration. Well, I am happy that your ears are now clear. There are no itchiness present, but definitely need to check out your house, and you can notify the person house that you stayed with, because there's definitely a problem, or maybe they had it from another person, but it's something that needs to be taken care of, and they can peek into your bed. Oh no, with pets there's no issues if you have cats or dogs. No. This is not an issue with pets. It's something that is for us humans. Well, if you have any questions, well, it was a pleasure. Thank you so much for coming, and please take a look into your house. And we're gonna have another appointment in 4 weeks again. No, actually 2 weeks for the biopsy. Okay, and for your blood drawn, that is going to be taken with the nurse. Yeah, we need to see those results in about 2 weeks. Of course, take care, and it was my pleasure. Bye bye.